Hello friends, welcome to my channel. This is Dr. Amol Pathrikar, consultant psychiatrist in Aurangabad-Maharashtra. Love and care is a solution for mental health. So in last video, we have discussed about the general mental health conditions, general mental health abnormalities and how to keep our mentally peace. Okay, so now today we are going to discuss about one mental health condition which is called as depression. Okay, so what is depression? Depression means when there is a persistent sadness of mood and there is a loss of interest in pleasurable activities, then we say it is a depression. In our day-to-day life, we very casually use this depression. It happened, I was in depression, I went in depression, something happened and I went in depression. We use very casually this word, but actually it is not there. What is the criteria of this depression? When you say I am suffering from depression? Depression when there is this persistent sadness of mood happens, and that to be most part of the day, and that runs for at least 15 days. Then we say then this is in depression. So what is the component of depression? What are the other symptoms and signs of depression? Our patients of the depression, they feel sad, they feel nervous, they feel loss of interest in pleasurable activities, that which the things which used to give pleasure in the past, that now is not pleasurable at all. Patient gets anxious, they feel lethargic, they lost motivation, they feel life is worthless, they feel nothing is there in the life. Even sometimes they feel there is no good things in life and I need to end my life. So which we call as suicidal ideation. Then there is a depression. There are certain complaints of the depression, like there is a sleep disturbances are there is a different dietary abnormalities or dietary changes happen in depression. Second thing, there is a loss of motivation. Certain physical component or symptom also comes under the category of depression, like abdominal pain, headache, body ache, fatigue, muscle pain. That symptoms are also included in depression, or these are all stress reduced symptoms. Okay, so now what are the causes? We say again is stress. When something happen in our life, some stressful situation or event happen in our life, then you start with the depression. Or when stress is there, when stress is small, but it is a persistent which is going since long time, then there are certain changes happening in our brain. There is a change in brain chemistry. Everyone should know that what we think, what we feel, how we behave, actually it is controlled by certain chemicals or hormones in our brain. They decide how we think and how we behave. So when there is this abnormalities or changes or fluctuation in these hormonal levels, we tend to behave in that pattern. So there are certain hormones. When serotonin, norepinephrine kind of hormones, when their level goes down, we feel sad. So change in biochemistry or brain chemistry, there is another reason. Stress causes that change in biochemistry. Another thing is genetic. There are certain gene presentation in cases of like depression. Like depression means depression runs in families. Is one of the parent is suffering from depression, the chances of getting depression in siblings, they are also high. Third thing, because of stress, we move to or we take in help of like certain substance or addictive substance like alcohol, cannabis, tobacco, many certain kinds of addictions are there. That again disturb your brain chemistry, which is again reason for your depression. Or there are certain things happening, environmental factors, that is factors surrounding us, and unemployment, poverty is there, marital conflict is there. So any kind of stress happening in our life, that gives, these are certain reasons. Past history like your childhood history of certain molestation, abuse, or the stressors in our childhood like parental conflict, parental separation. So these are certain things, that is again another reason for getting depression. Okay, so we have seen the certain causes and risk factors for depression. So friends, we discuss about right now what is depression, the causes of the depression and the risk factors for the depression in this video. In next video now, we are going to discuss about the types of the depression and how we are going to manage that depression. So guys, if you like this video and feels valuable for you or your family, so then please like it, share it, subscribe it. Thank you so much.